Alright guys, last short video here. Sorry for the extra ones. There's just a lot of material with the hip and thigh and all that. So the last one finished up, we were talking about when you're starting the strengthening phase, it's good to start with just active range of motion, pain-free, utilizing the weight of the limb, working against gravity, and then you can add like an ankle weight or go to weight bearing like a body weight squat or something like that. And then also just that it's important to use core exercises since all the core muscles, the obliques and the transverse abdominis and the rectus abdominis, all those other core muscles all attach to the pelvis, and so that needs to be incorporated as well. Okay, so then just looking at some strengthening exercises as we progress past those active range of motion exercises. We can get into a weight room and start utilizing barbells or dumbbells, stuff like that. So here's just a barbell squat, a back squat. So usually this is going to be a little further along in their strengthening program, but definitely is important to incorporate some form of a squat, whether that be a back squat, front squat, dumbbell squat, something, kettlebell squat. And this is going to be a good one for the hips, for the hip extensors mainly. So the glute muscles, even the external rotators, piriformis, glute med, stuff like that. So that's a good one for hip extensors, kind of hold the whole posterior hip chain. Then right here is a little simpler version. This is more what we're going to be doing in a rehab setting in like an athletic training room or a physical therapy clinic. So there's just some sort of weight that they've got attached to their foot, and they're working on hip internal and external rotation as they pivot back and forth. Picture C, this is also something that we might be able to incorporate in a clinic. Some sort of forward lunge. You can just start body weight, and then after that, they've added a step in here, so you could be going onto a step or down from a step. And then this lady's also incorporated a dumbbell, so making it even more difficult with adding weight. So definitely something that we can do in the athletic training room. And of course, always start. Remember, we want to do progressive resistance. So start body weight and then add the step or the dumbbell or something like that. And this is good. This will work the quadricep muscles. This will work the glutes. This will work the hip flexor. So really a good all-around exercise in my opinion. Picture D here, I do really like for the hip flexor, just because sometimes it's hard to isolate exercises with the hip flexor. Obviously, if we're laying on our back and we do that straight leg raise that I was talking about, you can isolate the hip flexor with that. But this one's good because you can focus on your form. So if you're a runner or you do a sport where there's running, you can focus on running form. In this picture, the clinician is providing a resistance against hip flexion. But I mean, you can totally do that. I would prefer to use some sort of resistance band, like a TheraBand or resistance tubing or something. And you can attach that to the ankle and then attach that to the bottom of a chair or a table or something. And then she would just be working on repetitively bringing that knee to the chest, hip flexion, trying to focus on running form. So she might even be pumping the arms at the same time. So I think that's a good way to work on hip flexion as a strengthening exercise. If you're trying to isolate the hamstrings for strengthening, E and F right here are really good for hamstring strengthening. Okay, so this one, you got a Swiss ball, yoga ball, and you're going to put your heels on the ball and extend your hips up, and then you're going to roll the ball out this way, extending the knees so you're in a nice straight line, and then roll your heels back in towards your butt. Roll out, roll in, roll out, roll in. And that's called a hamstring curl, or a Swiss ball hamstring curl or something like that. And so that's a good one to isolate the hamstrings. If you were doing it with a clinician, you could do it like this. She's just laying on a table and she's bringing her heel to her butt, and he is providing resistance against her heel. And obviously, he can change how much resistance he gives. Again, you can also do this with resistive tubing. In a weight room, you also have a hamstring curl machine that you can do this with. So lots of different options. And then as you progress the hamstring exercises, this is a great one when they're ready to progress and they're getting close to return to play. So they're upright, the clinician has locked their legs down, and then she's going to control this fall towards the table. And usually you put your arms out at the end and catch yourself on your hands. And then you push yourself back up, and then you control your fall back down. So it's an eccentric exercise. I think I've mentioned before that eccentric exercises are always more beneficial for strength gain. So this is a really good hamstring eccentric exercise, using your hamstrings to control that fall all the way down and then pushing yourself back up. You can do this other ways. You could lock your feet under some sort of bar on like a bench or something, but it's easiest to have a partner that is holding your feet down. Okay, H right here. I like because a lot of times it's hard to isolate adductors, the adductor muscles. So some sort of resistance tubing, and then it's attached to your lower leg, and then she's just pulling across repetitively, engaging all those adductor muscles, the gracilis, and then the 3 or 4 other adductor muscles that we talked about. Okay, this is one of those isokinetic machines we talked about. You might see this in a PT clinic or a doctor's office, but probably not in an athletic training room. I'm not a big fan of isokinetic because it's not very functional, but it can be a good test if you're returning from some sort of surgery or something, and you need to have some measurable outcome. Okay, and then over here it looks like she's doing some knee extensions. So just extending the knee as far out as you can. She's got some weight on there. So this is going to isolate the quadricep muscles. So if you're coming back from some sort of quad strain or something, this would definitely be beneficial. If you're coming back from the hamstring strain, these are all going to be beneficial. I don't like knee extensions for a functional exercise, so you definitely wouldn't be using this during your return to play phase. But maybe at the beginning of your strengthening, they're not ready to be doing other stuff yet. This could be like a way to kind of ease your way into the strengthening phase with a knee extension. But as you are able to do exercises that are more functional, you really should switch to something like this lunge, which obviously works the glutes and the hip flexor, but also works the quad. The squat, which works the hip extensors, but also works your quadricep muscle. Stuff like that, because these are more functional and more sport specific in general. I can't think of a sport this would be very specific to, but obviously if you had a situation where it was, then that would be a great time to use it. Okay, these are just some core exercises. Obviously there's a ton of core exercises out there. So this is just a very small assortment of exercises you could do. And this one, he's got his heels on the Swiss ball. He's going to work on tapping his butt to the floor and then bringing them all the way up. It's working hip extension. It's also working the low back muscles and the other core muscles. Another way to work on that hip extension, right here, lying on a table, letting your feet come down and then raising them back up. It's really going to isolate the hamstrings and the glutes. In picture C here, he's working basically the side of his core, so like obliques, and maybe some lats and stuff like that. So feet up on the Swiss ball, he's going to tap his hips to the floor and then raise them back up. Honestly, just a normal side plank would work. You can even do hip taps with a side plank. You could there's a lot of different variations you could do with a side plank. But being on the Swiss ball does make it an unstable surface, makes it a little more difficult, so it's a nice option. Exercise D here is a plank. Just a normal plank is great for some strengthening of the core. What she's doing here is lifting one leg, which means so when she lifts that left leg, then her right pelvis has to stabilize. So the right side of her abs, the right side of her glutes, the right side of the low back muscles all have to engage and work together to stabilize the pelvis so that she doesn't twist or turn as she lifts that leg. Then she brings that leg down, touches it, raises the other one up, and then the other side has to stabilize. Okay, this E here is called a bird dog. Really common core exercise in sports and athletics. Most strength and conditioning programs have them. Is similar to this in that you have to stabilize the pelvis as you go opposite arm, opposite leg in the air, and then you'll come back down and switch. So you're trying to maintain this nice straight line the entire time from the low back through the hip and down the leg. And then F just looks like she's doing some bicycles, kick the leg out, and then bring it back in, alternating and having the arms move along with it. Okay, neuromuscular control and dynamic stabilization are really important for all of the lower body segments that we do. Just because, basically anything you do, the lower body, you're usually leaving the ground in most sports. If you think about most sports either have a jumping component, or if they don't, there's a running component, and running is really a series of jumps in a forward motion. So if you think about it, all lower body exercises need to be able to have good dynamic stability and good neuromuscular control because of the fact that you are jumping. Whether you're running or actually jumping, it's really just a series of jumps. And so one thing that can help with that is to work on the different aspects of plyometrics for lower body. One being single leg hops. So a single leg hop being you are on one leg, you jump and leave the ground, and you land back on that same leg. So that would be a hop. And then a double leg jump being on both legs, loading both legs and exploding into the air, coming back down on both legs. And then the other thing that is important to work on is a bound. And a bound is when you load up on one leg, explode into the air, and you land on a different leg. Okay, you can do that laterally, you could do that forward to backwards. But if you're leaving from one leg and landing on a different leg, then that would be a bound. Okay, and that's probably going to be a quiz question, so you want to make sure you remember that one. But those three things are going to be really, really good for neuromuscular control and dynamic stabilization. And so one thing that I like to focus on is first doing those very slow. So you think about a single leg hop, loading up very slow and controlled. The knee is in control over your toe. You're balanced. You jump up, you leave the ground, you come back down, and you completely slow down to zero. You stabilize. You come to a pause where you're balanced before you move on to the next repetition. Okay, so that's going to really help your neuromuscular control. Same thing with a lateral bound. You could load up on one leg, explode into the air, land on the other leg, and slowly stabilize onto that leg. Knee in control, pause, come to total balance before you go into the next rep and jump off of that leg onto the other leg. So that's going to really help your neuromuscular control. Okay, another quiz question. Okay, then your dynamic stabilization is going to come when you speed that up. So now you're going to load on one leg, explode off of it, land on the other leg, and quickly, as fast as you can, load back up and explode onto the other leg. So it's happening quickly. And that's going to be dynamic stabilization. Okay, so those are really good exercises. And then just same functional progression back. You want to make sure that